questions related to the heart, along with detailed explanations for each answer. 1. A stab wound to the left fifth intercostal space at the midclavicular line would most likely injure which cardiac structure? A. Right atrium. B. Right ventricle. C. Left ventricle. D. Left atrium. Explanation: the left ventricle is located at the fifth intercostal space, midclavicular line. A deep stab wound in this location can penetrate the pericardium and myocardium, leading to cardiac tamponade or hemopericardium. 2. Which heart chamber is most posterior and can compress the esophagus when enlarged? A. Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. Explanation: the left atrium is the most posterior chamber of the heart. Enlargement, e.g., in mitral stenosis or left heart failure, can cause dysphagia, difficulty swallowing, due to compression of the esophagus. 3. Which artery supplies the SA and AV nodes in most people? A. Left anterior descending. B. Right coronary artery, RCA. Left circumflex artery, LCX. D. Posterior descending artery. Explanation: the SA and AV nodes are usually supplied by the right coronary artery, RCA. Blockage of the RCA can cause sinus bradycardia or heart block due to ischemia of these nodes. 4. A 60-year-old man presents with ST elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? A. Left circumflex artery, LCX. Right coronary artery, RCA. C. Left anterior descending. D. Posterior descending artery. Explanation: ST elevation in leads 2, 3, and AVF TOF indicates an inferior wall myocardial infarction, MI, which is most commonly due to occlusion of the right coronary artery, RCA. Which heart valve is most commonly affected in rheumatic heart disease? A. Aortic valve. Pulmonary valve. C. Tricuspid valve. D. Mitral valve. Explanation: rheumatic heart disease primarily affects the mitral valve, causing mitral stenosis or mitral regurgitation due to chronic inflammation and fibrosis. 6. A patient has an aortic dissection involving the proximal ascending aorta. Which layer of the vessel is disrupted? A. Intima. B. Media. C. Adventitia. D. Pericardium. Explanation: aortic dissections begin with a tear in the tunica intima, allowing blood to enter the media, creating a false lumen. Type A dissections, proximal, require emergency surgery due to the risk of cardiac tamponade and rupture. 7. The left anterior descending artery, LAD, supplies which part of the heart? A. Right atrium and SA node. B. Anterior left ventricle and interventricular septum. C. Posterior left ventricle and papillary muscles. D. Right ventricle and tricuspid valve. Explanation: the lat is the most commonly occluded artery in myocardial infarctions and supplies the anterior wall of the left ventricle and anterior 2/3 of the interventricular septum. 8. A patient presents with a holosystolic murmur best heard at the lower left sternal border. What is the most likely diagnosis? A. Aortic stenosis. B. Mitral stenosis. C. Ventricular septal defect, VSD. D. Aortic regurgitation. Explanation: VSD produces a harsh holosystolic murmur heard at the left lower sternal border. It results from an abnormal opening between the left and right ventricles, allowing left to right shunting of blood. 9. Which congenital heart defect causes differential cyanosis? Cyanosis in the lower extremities but not the upper body. A. Tetralogy of Fallot. B. Atrial septal defect, ASD. C. Patent ductus arteriosus. D. Coarctation of the aorta. Explanation: a PDA that remains open in an adult can lead to differential cyanosis, where oxygenated blood reaches the upper body, but deoxygenated blood flows to the lower extremities due to right-to-left shunting. Shasher 10. Which structure prevents the tricuspid valve from prolapsing into the right atrium during systole? A. Interventricular septum. B. Papillary muscles. C. Moderator band. D. Coronary sinus. Explanation: papillary muscles attach to the chordae tendineae, preventing valve prolapse during systole. If papillary muscles are damaged, e.g. after an MI, the valve can regurgitate, leading to right-sided heart failure. These clinical anatomy questions test high-yield cardiovascular knowledge relevant